Hello everyone! I am Mariah Angela F. Pineda, a student nurse from BS Nursing 1, and we are going to discuss Nurse as Educator. So, nurses as educators play a key role in improving the health of the nation. Educating people is an integral part of the nurse's role in every practice setting, may it be in schools, community, work sites, healthcare delivery sites, and homes. Health education involves not only providing relevant information, but also facilitating health-related behavior change. The nurse, using health education principles, can assist people in achieving their health goals in a way that is consistent with their personal lifestyles, values, and beliefs. Nurses usually function as healthcare coordinators for individuals in their care. Depending on the interests and needs of a person, nurses establish a partnership to guide the individual in the selection and uses of relevant health services. Principles of health education provide the nurse with strategies and tools for assessing an individual's readiness for health teaching, with technical information and with help in practicing healthcare techniques at home, and these strategies also help the nurse facilitate behavior change while satisfying the person's right to relevant health information and the freedom for people to make decisions about their own health. Health education encourages self-care, self-empowerment, and ultimately, less dependence on the healthcare system. Now moving on with the roles of nurses. First is the giving of information or giver of information. Given a situation wherein a patient who is unaware of a potential harm or adverse effects or the benefit of the medications, or even the relatives or family members are not really knowledgeable on the potential effects of a particular treatment or a medication, this is where we could give them insights, valuable education insights as to telling them the information that they will be needing. Nurses have to simplify instructions or medical terms using layman's terms. So by using those kinds of words or terms, your patient or your relatives or the relatives of the patient will truly understand what you're trying to say. And also, use teach back and show back, in which patient or family member could restate information provided by the nurse or any health team and display new thought skills to increase understanding and decrease confusion. Next, we have a facilitator of learning. The conversion of a nurse to a facilitator of learning means switch from content transmitter to process manager. Nurse can convert traditional method of instruction into facilitator mode of teaching and learning. So rather than just going to the traditional manner of just keeping on talking, you are the ones giving out primary information, and if you will be a facilitator, you will just be guiding the patient all throughout the health education process. Meaning, you'll also be listening to the feedback of the patient, and you will also be evaluating the improvements of that patient performance in terms of your education. Furthermore, this is to assess the need for and to develop and manage and coordinate programs of clinical education for patients. So if you were able to see or evaluate there is a need for a nurse or an education program for the patient, then you have to establish and facilitate. So, you have to assess properly if there's a deficiency in terms of knowledge. In addition, clinical education facilitators are responsible for the selection and organization of training. We will be the one to set a schedule, the venue, and the appropriate person that the patient will be able to speak with to address his or her concern. Moreover, we have to help the learner or patient become aware of what he needs to know and the value of why do you have to teach them this kind of topic. Lastly, the opportunity to open discussion among the health team members. Through that, you will be the vessel and you will be the facilitator of the whole process of giving out appropriate education to your client. Next is we have the qualities of a good facilitator. First is being a good communicator. So, we have to have the question skills. We have to ask questions that we can derive a very good evaluation and assessment on what really are the health needs of our client. Next is we should be somebody who would be very guiding to our patient. That our patient could cooperate, Then for conflict management, since we may be able to encounter conflicts between the family or other health providers, we must be able to address and know the process of conflict management leadership. Then we can act as a leader. We must have self-awareness and make sure that we are aware of ourselves and we know our strengths and our weaknesses before we talk to the patient and before we teach them so. Then, you must be fully aware of your competencies of your skills. Also, a provider of education or learning must be approachable. We must be somebody who is not intimidating so that our client will be open to us. Furthermore, be empathetic. Meaning you have to put yourself in the shoe of others and we have to feel what our clients experience so that you would also appreciate your status right now and you would really understand the suffering or the pain or the happiness of our patient. And just like being empathetic, we have to be sensitive. Sensitive of the needs of our patients, and we must be able to detect if they are sad, happy, anxious, or misunderstood something that we have said. Lastly, being able to negotiate. So if there are conflicts in the schedules or if there are some things that are not going based on our plan, we have to negotiate it properly. Moving forward to the roles of facilitator. They provide structure for learning. They guide the learners. They identify learning resources. They also encourage cultural competence. They motivate learners. They support them in the theoretical and clinical settings, and they act as a role model. Next is being a coordinator of teaching. Nurses are responsible for ensuring that patients are able to understand their health illnesses, medications, and treatments to the best of their ability. And a nurse should take time to explain to the patient or to the family or to the caregiver what to do. Lastly, of course, we have to tell them what to expect when they leave or after they will be discharged from the hospital. Proceeding with being the advocate for the client. You act as the voice. You would represent the client on their behalf and protect them. And we will be centering the patient care, addressing the patient's needs, and we will verbalize what is their opinion and what are their concerns. The nurse must also represent the client's needs and wishes to other health professionals, such as we relay the client's wishes for information to the physician. If the patient would say, "I don't want to undergo the procedure tomorrow," you must be able to advocate for the client and tell the doctor or the physician of the concerns of the client or the patient. Also, assist clients in exercising their rights and help them speak up for themselves. Another thing in being advocate for the client is to advocate for the best interest of patient and to maintain the patient's dignity throughout the treatment and care. Still, we have to have the privacy and we have to cover the patient and also close the door or the curtains because again, we have to respect the patient. Then we have to make suggestions in the treatment plan of patient in collaboration with other health professionals. So we can speak in behalf of the patient and give what suggestion to health providers or other health team, which is why we have to support the patient and represent the patients with its best interests, especially if we do decision making. We will be there to support the patient, give suggestions, especially if decision making would be done for the improvement of the health of the patient. Continuing with the role of other members of the health team. So we define team. It is a distinguishable set of two or more people who interact dynamically, interdependently, and adaptively towards a common and valued goal, objective, mission, who have been assigned specific roles or functions. On the other hand, we have team-based healthcare. It is the provision of health services to individuals, families, or their communities by at least two health providers who work collaboratively with patients and their caregivers to the extent preferred by each patient to accomplish shared goals within and across settings to achieve coordinated, high-quality care. So for the members of the health team, first is the core teams. They are involved directly in the patient care and included are physician, nurses or the nurse attendants, resident on duty, and physical therapists. Second is the contingency teams. They are committees that are being built or organized for a specific function, and included are the Code Blue team, Disaster Response team, and the COVID-19 Task Force. Third is the ancillary teams or services. They are not directly involved into patient care, but they contribute to the welfare of the patient. Included are the laboratory, radiology, central supply, food and nutrition, finance, and pharmacy. Last topic is the role of family in health education. According to the Institute for Patient and Family-Centered Care in 2010, the word family refers to two or more persons who are related in any way biologically, legally, or emotionally. The patient would define who would represent his or her family and the level of involvement each family member will have for the patient. Their purpose is to provide thorough information of the patient information, participate or assist in the patient care, vital decision-making, increase the comfort levels of the patient, and decrease anxiety level of the patient. And that would be all. Thank you for watching.